If you've never had shin splints, first of all, congratulations, I'm jealous of you, so enjoy that. But second of all, you just don't know how big of a pain this muscle can be. Now, it's not the only muscle that contributes to shin splints, but let's be honest here, it hurts, and this is where you are going to feel it. This is the tibialis anterior, and it is one of 4 muscles that belongs to the anterior compartment of your crus. And in today's video, to learn about this, we are going to be looking at this 100% free Kenhub article that we've gone ahead and left a link down in the description below so you can follow along with me. But let's go ahead and learn everything you need to know about the tibialis anterior, because this muscle, as thin as it is, has just a very unique relationship with the tibia, and that's why it creates or influences shin splints, which is really called periostitis. Now let's explain how this works. So I'm gonna go ahead and go over here, and we're gonna look at the origins. And I say origins because there's multiple for this muscle. And so this is an anterior view of the knee. We can tell because we can see the patella. You can also see the femur here, you can see the tibia, and then you can see the fibula. But the patella is the real giveaway that this is an anterior view of the knee joint. This is what is called the lateral condyle of the tibia. Now, condyle just means knuckle. And so this is going to, I guess, have a knuckler shape. I don't think that's a real word, but I like using it, so I'm going to keep using it. This right here is, again, this is just going to be one of the origins now, but it's not the only one. So the next origin that we can see is just going to be what's called the lateral surface of the tibia. Now, how you know this is the lateral surface is because, well, it is the side of the tibia that is closer to the fibula. And the fibula is the lateral bone of the crus. And so tibialis anterior is going to originate all along here. Now, here is where we start to understand why tibialis anterior contributes to shin splints. And that's because you see this right here. This is a sharp ridge line on the tibia that you can feel. Go ahead right now. Just feel that nice sharp ridge on your tibia that everyone calls their shin. Well, what's happening if you don't maybe you've never heard this actually. So what happens, how muscles attach to bones is their epimysium, which is the outer connective tissue of the muscle, will actually blend directly with what is called the periosteum. And now typically they don't do it in this really superficial way. What happens, in fact, let's go to this view here to see this, and hopefully this will give us a good understanding. I want you to imagine, so here in green is the tibialis anterior. I want you to imagine that there is a connective tissue sheet on top of it, because there is, called the epimysium. And then on top of the bone itself, there's a connective tissue sheet called periosteum, okay? Well, they are both made of what is called dense, irregular connective tissue. There are nuances between them in terms of, like, if you start to look into them histologically, but like at a very grand, broad level, they are the same type of tissue. What happens is they merge with each other right here. And so as this muscle is going to perform its actions, which we will see animations showing its actions coming up, what's going to happen is it is going to tug and yank on the periosteum in ways that typically does not happen. Now, obviously, epimysium always blends with periosteum. It always does that. That's how a muscle attaches to a bone. However, that is typically just at like one end versus another. What we have here is a whole surface of this muscle just yanking on it. And what it can create is what's called a fascial tractioning syndrome, where it starts to pull and inflame and irritate the periosteum, which is why shin splint's real name is periostitis, inflammation of the periosteum. And so this is just due to the unique relationship of the anatomy of the tibialis anterior. All right. So then it's also, but that's not its only origin. It's also going to originate here on what is called the interosseous membrane. So the interosseous membrane, this is a fibrous joint. Fibrous joints are just a bunch of connective tissue that is going to connect bones together, obviously. Now, there are 2 interosseous membranes. There's another one up here in the anabrachium, and then this is obviously going to be in the crus. So tibialis anterior is also going to be originating on here. But if we go back to this view, what you're also going to see is we can see some of the retinaculi, right? So the retinaculum, that is going to be connective tissue that's going to help bind tendons down. You can see tibialis anterior traveling deep to it, and then it's going onto the medial side. And it's a little difficult to see in this image here, but what it's going to be inserting at, or where it's going to be inserting at, is what is called the medial cuneiform. So the medial cuneiform, and it can even go towards that, the base of the first metatarsal. But that medial cuneiform, and what it's going to do is it is then going to pull on that part of the foot, and we're going to be able to see what that looks like in animations coming up very, very shortly. But so those are going to be our attachments for the tibialis anterior. But I do want to also discuss, and we're going to scroll down here, the innervation. So this will probably be the best one to look at, the innervation of the tibialis anterior. And this is going to come from what is called the deep fibular or deep peroneal nerve. Now, this right here is a branch of the sciatic nerve. So traveling down the back of your leg is the sciatic nerve, but it's really two nerves bundled together. You have what's called the tibial division and the common fibular division. Then at the knee, what's going to happen is they split, and the common fibular is going to start to make its way into to like the lateral and anterior side of the crus, and then it splits again. And that's what we're seeing here. So it's common fibulars coming around, and then it's going to split again into what's called the superficial, right? Superficial peroneal or superficial fibular, and then also to the deep fibular or deep peroneal. And so this is the deep fibular nerve, and it's going to just travel down, and it's going to go all the way into the dorsal part of the foot. This is the nerve that is going to supply that tibialis anterior, which means if someone is having sciatica pain, right, maybe like they have herniated discs, it can actually create issues all the way down in the front of their legs, which is just never a good time. All right, so let's go ahead and scroll to the top, because what we're going to find at the top. So again, these videos are all, the articles, I should say, are all free, but we like to embed and put in premium features, and the videos that we place at the top of these articles are one of those premium features. But I want to show you how powerful and helpful these can be. So what we have here is an animation of the foot, the ankle joint, and we're going to see how tibialis anterior is going to pull on it. So let's just kind of orient ourselves to what we're looking at. You can see a medial view of the foot, and you can see the tibialis anterior coming here. We can see its tendon is traveling anterior to the ankle joint, and then is going to be inserting here at that medial cuneiform, and then that base of the first metatarsal. All right, now the reason why I think it's important to understand that it's traveling anterior to the ankle joint. This is a rule. I want you to burn this into your brain. I teach this to every single one of my students. Whenever you are looking at a crus muscle, the first thing you want to look at is the actual ankle and see which side of the ankle the tendon is traveling on. If the tendon is traveling on the anterior side, that is going to perform, let's actually look at it. It's going to perform an action, which we see here called dorsiflexion. Now you can also sometimes see this be called dorsal flexion. It's the same thing, potato type of thing, which is basically the toes are being lifted towards your nose. All right, so this is dorsiflexion. If a tendon is traveling anterior to the ankle joint, it will always perform dorsiflexion. If, on the other hand, you can see these white muscles here. This is just trying to give you some perspective as to other muscles that are in the area. If they are traveling, you see how all of them are traveling posterior to the ankle joint? Like this one right here is showing gastrocnemius, for example. It's pretty far away. It doesn't matter. If the tendon is traveling behind, posterior to that ankle joint, it will perform plantar flexion. So again, for our purposes, we just saw it. It performs dorsal flexion. In fact, I want to show it to you one more time. Let's go back so we can see this again. You can see the foot in that kind of stable neutral position. Push play here. And what we're going to see is toes coming up, and that is dorsiflexion. But that is not it, right? The tibialis anterior is also going to have another really important function. So again, so now we are back to our neutral position. And what we're going to be looking at now is below the ankle joint. So I just want to highlight a couple things. So this right here is going to be the talus. The talus is one of 7 tarsal bones. These are the bones of your foot, or sometimes also called the ankle bones. And then right below it is this massive bone called the calcaneus, another one of the 7 bones. This is your heel bone. Between them is a joint. This is called the subtalar joint, which makes sense because sub means below, and this is the talus, and it is the joint between those 2 bones. This is where the action is primarily going to be at. Now, I want to mention that what we're about to see is basically going to be primarily, again, happening here, but there's also going to be little twists and turns that are happening in the other joints as well, but primarily it's going to be here. So let's go ahead and watch this, because tibialis anterior performs what's called inversion of the foot. So inversion of the foot is kind of like you're driving your pinkies, your pinky toes, into the ground, right? There's another companion action called eversion, which is where you're basically digging your big toes into the ground. So inversion, so here's your neutral position. It slides it into your pinky toes into the ground. So I want to go back and watch this again. So let's go ahead and let's see if I can come here. All right, so here's our neutral position. Let's watch what's happening. It's going to be happening in this area. It's not really happening in the ankle. The ankle is a hinge joint. It only does plantar and dorsiflexion. All right, so let's go ahead. Press play. Here we go. Here's our neutral position. And you, sure enough, and I'll go back one more time so we can see this. If you keep your eyes right here, you'll be able to see this in action. So let's look at it. There it is. That is what we call inversion. But that is not it. There is another function to the tibialis anterior. But this one is not really an action at a joint as much as it is supporting. Right? It's supporting what is called the medial longitudinal arch. And you can see that here in this blue line. So there are different archways in the foot. You have a lateral and a medial longitudinal arch, and then you also have a transverse arch. And what happens is a strong tibialis anterior is going to help keep that arch and maintain it, which is essential for foot health, which also will translate to other health for the rest of your body. Because if this arch is not strong, it can collapse the foot and you can get what's called flat foot. And flat foot is extraordinarily harsh on the body. The foot rather, is meant to have these archways because then they can act like springs and to help you bounce back up. So tibialis anterior is definitely going to assist in having a nice, strong medial longitudinal arch. But my hope is that this has been helpful to you. Again, we've gone ahead and left a link down in the description below to this free article. Be sure to check that out. While you are down there, what you could do is go ahead and like this video. That little things like that go a really long way and just help it perform better in the all-powerful YouTube algorithm. And then also, if you want to leave us a comment, let us know what other videos you'd like us to discuss in the future. That would be much appreciated. But thanks for hanging out with me, and I will see you next time.